All right. Hi, everyone. Can you hear me? Let's see. Excellent. Okay. Hi, everyone. I'm Dr. Aylah Clark, and I am a naturopathic physician at Whole Health Wellness Center in Avon. And I'm going to be talking tonight about nutritional strategies for lymphedema. And before I get started, I wanted to mention that at the very end, there will be an opportunity to sign up for a free 15-minute consult with a member of our team, just in case you want to talk about whatever, if it's some insurance questions or what you might expect if you're not already a patient yet. So without further ado, I'll go ahead and get started. Okay, so tonight I'm going to be talking about certain foods to avoid, specific nutrients to target to help support the lymphatic system, a little bit about nutrient timing and how that might be beneficial, and how other naturopathic strategies can be helpful for lymphedema. And for that, it'll just be a brief little touch on a few different treatments that you might not be as familiar with, even if you've had lymphedema for a long time. I'm not going to talk about other very common treatments like compression garments and lymphatic massage, but just a few, more interesting things that you might not know about. So big picture, the nutrition strategy with lymphedema in my mind is to have an anti-inflammatory diet, target plenty of antioxidants, eat foods that will help promote the lymphatic flow and support the vascular system. Another topic that I wanted to just touch on before we get into some of the details is this question: can weight loss help lymphedema? And for some people, this might be an obvious question, but it's not always as clear with certain types of lymphedema, and it really depends on the person. But if somebody is overweight or obese or has some weight to lose, then weight loss can help with lymphedema. And the important thing about this piece is not maybe the obvious part that I've talked about, but it's that if you can lose weight with a variety of different dietary strategies, whether it's low fat or a higher fat diet, weight loss can be beneficial for lymphedema, and there are different ways you can do it. What is right for each person can vary because you are all complex people. You're not just lymphedema. There are different reasons why one dietary strategy might be better for you and than somebody else, even though you both have lymphedema. We will talk about some of the details of things that will help lymphedema, but I did want to start with that of there's still different ways you can do this, and you can still see improvement with lymphedema, even if it's different for what other people are doing. One important thing on here is also that rapid weight loss is not the answer. So as much as many of us will want that strategy, it is really only going to make lymphedema worse. It can increase your risk of developing lymphedema. And so slow and steady is really the way to go. So what I mean by anti-inflammatory is really multifactorial here. So we're going to talk about different ways you can have an anti-inflammatory diet later. But the reason we want it to be anti-inflammatory is because the lymphatic system is closely related to inflammation and your immune system. So inflammation itself just involves inflammation, or inflammation involves immune cell infiltration and bringing those immune cells into the area they are needed in via the lymphatics. And there's also a close connection between the lymphatic system and numerous inflammatory metabolic conditions like heart disease, stroke, type 2 diabetes. those are closely related, and there are higher incidences of lymphedema in those conditions. And we know that despite what many people believe, lymphedema is not just a plumbing problem. It is not just that you have a buildup of lymphatic fluid that can't get out. It is also related to the inflammatory response in the tissue that's creating that edema. And so it's important to reduce inflammation, really to help control lymphedema, and that can be done in lots of ways, but as I mentioned, we'll talk about most of that later. I did leave this other bullet point on here to remind me to mention that addressing food allergies and sensitivities can often make a big difference for people that have lymphedema. And I'm not going to mention it again on this talk, but it is another strategy that is worth exploring for many people. Antioxidants can also be great tools for lymphedema, and these are things found in berries, dark chocolate, green tea, walnuts, leafy greens, all kinds of good stuff. I wanted to just explore this term a little bit more because I'm sure you're all familiar with the term antioxidant, but it doesn't have a lot of meaning to many people, or truly understanding the word. And so start with this quote here, that this imbalance between free radical production and antioxidant systems activity has been proven in lymphatic and venous diseases as well, namely in leg venous ulcers and varicose veins. So there's an imbalance of free radical production and the antioxidant system. So what that means is that these free radicals, which are unstable atoms that can cause damage to your tissue, to the venous system, to the lymphatic system, those are known for causing damage, and those are caused by oxidative damage. And oxidative damage can be the result of many different things, like smoking is an easy example. Smoking causes oxidative damage. And so you may not be a smoker, but there are lots of things in our environment, just day to day. Even the sun can cause oxidative damage. And so if we can balance out those systems with antioxidants, we can help prevent the damage that those free radicals cause. And that's why these nutrients, the first line there at the bottom, the vitamin C, vitamin E, NAC, selenium, are names of specific antioxidants, and that line below, the berries, dark chocolate, green tea, etc. Those are all the foods, some of the foods that those are high in. And so we'll talk again more about specific foods that we want to target, but that is one reason why we want to target those foods. And so I'm going to go back to the foods to eat in a little bit, but first I want to talk about a few specific foods to avoid. Sugar, processed foods, inflammatory additives, and hormone disruptors are the main categories I wanted to at least mention tonight. Okay, so as far as studies on sugar and lymphedema, one type of sugar that comes up is fructose, which is high in things like high fructose corn syrup, which luckily has become a little less common as an additive into foods, but it's still present. It's still worth looking at some labels to make sure that's not in there. But fructose has been shown to decrease the size of the mesenteric lymphatic vessels. The mesentery is an area of lymphatic tissue in your abdomen, and so that's a major thoroughfare for your lymphatic system. And so that actually decreases the overall output of your lymphatic pump. And we don't want to slow that down. And so it doesn't mean you can't have fruit, which is another source of fructose. Whole fruits are fine, but I would avoid drinking fruit juices and that high fructose corn syrup. I'd also get into the habit of reading labels of things that you eat, especially things you eat regularly, because those hidden sugars can really sneak up on you in different sauces and bars and all kinds of things. Cereal is very commonly high in sugar as well. So I often tell people to aim for under 30 grams of total added sugars daily. And that includes things like maple syrup. Just because it's natural doesn't mean it's healthy and it should be added liberally to things. And for individual items like a cereal serving or a bar, I try to keep that under 7 grams of sugar as well. And I also want to advise people just to avoid the artificial sweeteners like sucralose and aspartame. Those aren't great substitutions either. I feel a little bit better currently about stevia and monk fruit. Hopefully no evidence comes out in the future telling me those are not good either, but for now, those are better options. Okay, so processed foods are a big category of foods because altering a food during preparation technically makes them processed, but I'm not so worried about the more minimally processed foods, more so about ultra processed. Research has shown that ultra processed foods can contribute to things like food addiction and binge eating, and that, as you may know, is a big problem in this country, and we need all the help we can get as far as these habits and these foods that create food cravings for things that are not so good for us. But it's even, well, I won't say more importantly, but also importantly, these foods can promote low-grade chronic inflammation. And so I would advise trying to shop in the perimeter of a store. Try to imagine your food growing. If you can still picture it, that head of broccoli growing, you know it's a little closer to the source and it's less processed. That means avoiding most of the center aisles. It doesn't mean you can't have things in there, but I think being more mindful about our choices and try to limit how many processed foods we're eating can help reduce inflammation. I also wanted to mention a few inflammatory additives, namely carrageenan and glutamate. These are both pro-inflammatory and they are found in all kinds of things. Carrageenan is mainly found in dairy to make things creamier or dairy alternatives like nut milks. And so if you regularly buy, say, almond milk or a certain type of yogurt, you might make sure it doesn't have carrageenan as an additive because it's just a lower grade inflammation promoting ingredient that you don't need. And there are plenty of options out there that don't have that in it. And same thing with MSG or glutamate. MSG stands for monosodium glutamate, and that can contribute, at least in most of the studies are in animals with MSG, but still they do show that it can contribute to liver inflammation and obesity in animal studies. And it's worth to me to try to limit these small sources of inflammation if it could help in the long term. Okay, so hormone disruptors are another category that I think is really important to try to limit our exposure to. There are many out there. A few examples are phthalates, bisphenols like BPA, and glyphosate. And these can affect lots of different conditions, but it can affect lymphedema specifically. So we know that your endogenous or your own body's estrogen can be protective, and that interfering with the signaling of estrogen in your body through endocrine disrupting chemicals, which are things like drinking out of plastic bottles, can increase your exposure to these chemicals that can change how your own body's estrogen functions. And it can affect receptor binding in your body of these hormones. And that downstream can actually make lymphedema worse. And so I think it's really important to try to be more mindful about our exposure to endocrine disruptors. And there are some pretty easy changes you can make to really reduce your exposure. That's avoiding microwaving in plastic containers, maybe swapping out for glass or transferring the food to a plate before microwaving, avoiding drinking out of plastic bottles, as I mentioned. And that includes plastic that even says it's BPA free, because they often replace the BPA with a different type of bisphenol like BPS that can also disrupt your endocrine system. They're just not as well known, and so they don't have the marketing behind them to get you to avoid those yet. Endocrine disrupting chemicals can be found in more than just your food and food packaging, but it is in different cleaning products and personal care goods like lotions and makeup. And if you really want to do a deep dive, you can go to environmentalworkinggroup.org or EWG.org, which is the Environmental Working Group's website. And their Skin Deep section of their website allows you to look up ingredients or specific, say, mascara or a cleaning product that you use, and you can see what degree of endocrine disruption it has. So I think that's a great resource and a great place to start, but certainly starting with the foods and the water bottles is a good place to start too. Okay, so let's move away of what we can't eat to what we can eat, what we should be eating, and specific nutrients to target. So I'm going to talk about fats, citrus bioflavonoids, spices, selenium, anthocyanidins, and bitters. And within this, we're going to get into some of the questions that come up about macronutrients like high fat and stuff like that. Okay, so healthy fats, it can most people in the medical world can agree that healthy fats are going to include things like the fats found in nuts, seeds, avocado, wild-caught fish, olives, and olive oil. And that's because these tend to be less inflammatory and higher in omega-3s. It is important to have these healthy fats be the primary type of fats that you eat, because your lymphatic system is the primary entry point of which your body circulates these dietary fats. And it also is a way to really steer your diet into a more anti-inflammatory type of diet. There are some studies on fat intake and the lymphatic system specifically, where fat intake does increase output from the lymphatic pump, which kind of makes sense because that's where they tend to go. And so if you ate more, they go into the pump, more comes out of the pump. Medium chain triglycerides are a type of fat that have been studied in lymphedema that are found in things like coconut oil, and that has been shown to significantly decrease the volume of legs and lower extremity lymphedema and the feeling of heaviness, which is really good to see. And this is even with a lower fat diet, you could still target MCTs or medium chain triglycerides, and you could see an improvement in lymphedema with that type of fat. This particular study was done in breast cancer related lymphedema, but still promising and good to see that data. So I mentioned that you could do a lower fat diet while still targeting those types of fats and see benefit. But I do want to talk about the whole fat conundrum in lymphedema. So a big question is whether or not fat and protein overwhelms the lymphatics. And that is because historically, there was this argument that said that the fat and protein rich fluids that are your lymph system, those are transported in your lymph. So a diet that's low in protein and low in fat will actually reduce the load on the lymphatics. But that sounds good in theory. On the surface, it seems to make sense, but we actually don't really have evidence that supports that is the way it actually works. And so what we do know is that your body needs fat and protein to function, and increased protein intake doesn't necessarily mean you see increased protein in the interstitial space, which is the space that we see edema and fluid buildup and lymphedema. And as mentioned before, fat does appear to increase the lymphatic flow. When you eat more fat, the flow increases. So it's not necessarily causing a backup there. And if you're doing grass-fed, wild-caught, organic fats, then you can also be eating an anti-inflammatory diet while still eating a higher fat diet. And the other question that comes up then is, well, can keto help lymphedema then? And so keto is a very high fat, low carb, and moderate protein diet. And you can do keto in a way where you're targeting healthy fats and avoiding fructose. There can be some healthy ways that will make your cardiologist happy too. Meaning you can do it without increasing your cholesterol or inflammation markers. And it does have some benefits in other areas that are well established, like controlling blood sugar, improving satiety, and helping with weight loss. And so some people really can respond well to it. There's a small study done by Dr. Leslyn Keith that showed improved weight, BMI, waistline circumference, a decrease in limb volume, and quality of life with lymphedema. And we also have seen animal studies that have shown that the increased fat intake does not actually make lymphedema worse. And so I think with all of this data, not to mention the many people that have lipedema or lymphedema that have done well and seen a reduction in their swelling and limb size, really is an indicator that this can be helpful for many people. It's not right for everybody, and that could be for a lot of different reasons. You could have genetics and cholesterol metabolic issues that make it a challenging diet to maintain all parameters of your health on it, or perhaps you have trouble digesting fats because you don't have a gallbladder or something like that makes it a little bit more difficult. So there's a lot of reasons why it's not the right diet for everybody, but there are a lot of people where it's been helpful. I do think there are right and wrong ways to do it, and it doesn't come without risks like nutrient deficiencies, but it's certainly an option for some people. Okay, so that the topic of fats is always a big one that I feel like I need to spend some good time on. So now we're going to go down into a few different specific nutrients, including citrus bioflavonoids. And this one I kind of snuck this one in here because it's not really one I expect people to get from their diet. It's really something that ends up being either a medication or a supplement generally, but it is from food. And so I wanted to mention it here. And so the reason why I wanted to mention it is because there are some decent studies on bioflavonoids and lymphatic and venous health. There are different types of citrus bioflavonoids. Hesperidin, rutin, and diosmin are a few of them, and I listed the foods that you would find those bioflavonoids in there. Of course, primarily citrus. So these compounds are antioxidants and they're anti-inflammatory. You can get them through diet, but the studies are often in sort of higher doses that you would be getting regularly. And the studies have shown reduced capillary fragility, edema, and bruising. And diosmin specifically has been shown to decrease the lymphatic pressure and increase the number of functional lymphatics and improve the lymphatic flow. And different combinations of these are options. So you might have even heard of Daflon or Vasculera or Diovasc. Those are various types of citrus bioflavonoid treatments that are often used to help with edema. All right, so moving on here. Spices are a great type of anti-inflammatory food to incorporate. That includes turmeric, curry, garlic, rosemary, and ginger are some of the most anti-inflammatory spices. They're also high in antioxidants, and they can help specifically with swelling and edema. And so I wanted to talk specifically about a couple of these things just to give you a little bit better of an idea of why you might incorporate these in your food more. So curcumin is the primary constituent of turmeric, and there are more than 21,000 studies on curcumin. And there are many, many, many ways this can be anti-inflammatory, and because it's just a multifactorial sort of way that it works. But it can reduce CRP, which is one of the most common inflammatory markers that you might have had on your blood work. Rosemary is really interesting because it can reduce LTB4, which is actually a drug target in lymphedema research. So LTB4 tends to be elevated in lymphedema. It's not something that we test for routinely on labs, but it is used in research and as I said, trying to find targets for treatments. And so that's elevated in lymphedema and is associated with inflammation and impaired lymphatic function. And we've seen through those research studies that targeting LTB4 through those treatments can improve lymphatic repair and actually reverse lymphedema to some extent. And so rosemary actually acts on that as well. And I couldn't tell you to what extent, but it's certainly worth incorporating in your diet along with these other things. All right, so if you've seen me before in the office and you have lymphedema, I'm pretty much 100% have told you to eat Brazil nuts. So Brazil nuts are the highest, one of the highest levels of selenium of any food out there, though it is also found in foods like oysters and animal protein and shiitake mushrooms. And one of the reasons why I do talk about Brazil nuts is because it's a safer form of getting selenium than from a supplement, because you can get too much and you don't need much, 1 or 2 Brazil nuts a day, 1 to 3, I would say. But anyway, so studies have shown improved response to physical therapy and radiation-induced lymphedema with the incorporation of selenium. It's common to see selenium deficiency in people that have lymphedema, and it also is associated, a deficiency is also associated with impaired immune function, and your lymphatics is a part of your immune system. And so we really want to at least make sure you're getting sufficient selenium. All right. And anthocyanidins. Anthocyanidins are a group of plant compounds that are primarily found in colorful blue, black, red, purple fruits and vegetables. And this, as I said, is a group of compounds. So it's a whole bunch of different ones, like those listed on that first bullet there. And many of these have been shown to improve vascular health primarily, as well as reduce inflammation. And of course, they are great antioxidants as well. If you incorporate berries regularly, you could see a change and an improvement in your vascular health potentially. There are berries that are even higher in some of these antioxidant compounds than blueberries and blackberries, so those are great choices as well. If you really feel like getting creative with some of those, there are some different frozen berries or berry powders that you can get that are incorporating some of these very great antioxidant berries that are not as commonly found at the supermarket, like aronia berry, lingonberries, huckleberries, black currants, and many more. But there are lots of good ones out there. And bitter foods are also kind of an interesting thing to try to incorporate for your lymphatic health. So you have bitter receptors in your tongue, as you know, and you also have bitter receptors in your intestinal tract. So you can actually, your body can respond to bitter foods even past your tongue. And not only that, but the nerve that innervates your tongue that receives that bitter sensation is called your vagus nerve, and it runs down from your brain down into your intestines and throughout your intestines, and it can help stimulate peristalsis, which is that gentle movement of your intestines, and the gastrointestinal muscular contraction, and that actually improves lymphatic flow. So if you haven't heard that you have, most of your immune system is in your gut. So it makes sense that a lot of your lymphatic system is there too. That is part of your immune system. And so that movement actually helps move the movement of your lymphatics through your abdomen. And so this is just a great, interesting thing to incorporate. So bitter foods, I mentioned a few at the top there that could be things on the more bitter end, like mustard greens, dandelion greens, black coffee, dark chocolate. And for some people, depending on how sensitive you are to bitter foods, I know, Brussels sprouts and broccoli might be bitter to some people as well. And that can also have an effect. I wanted to also give a plug to my colleague, Dr. Jennifer Stagg, might be 2 years now that her book, The Bitter Prescription, came out. And she talks a lot about how you can incorporate these foods in your diet. And it goes much further beyond just the bitter foods, but also a lot about just general health and healthy aging as well. So that's The Bitter Prescription by Dr. Jennifer Stagg. All right. So, okay. So moving on to nutrient timing. Nutrient timing, this I wanted to incorporate at least a little bit about this because it is kind of an interesting strategy for potentially seeing some benefits. And so mostly here I'm talking about intermittent fasting, which can be done in different ways. I mentioned the 16-8 or 5-2 there, and I believe on the next slide I talk about it more. Yep, there we go. So intermittent fasting essentially is limiting your eating window to some degree, and that could be 16-8, which is every day you fast for 16 hours. Typically that 16 hours is overnight, and you eat in an 8-hour window. One example of that would be that you might start eating at 10 a.m. and you finish your dinner by 6 p.m. A different way of doing intermittent fasting is the 5-2 fast, and that is where you fast for 2 non-consecutive days of the week, and then you just eat regular meals the other 5 days. So an example of that would be you eat every day regular meals, and then on Tuesday and Friday, say, you only have dinner, but you have that dinner 24 hours after dinner the previous day. So if you had dinner at 6 Monday night, then on Tuesday night you might have it, 6:30, 7 o'clock, to have a true 24-hour fast. And so why would we be doing this, is the question. So we have a lot of data on intermittent fasting and improving blood sugar control for prediabetes and type 2 diabetes, improve body composition, even if you're eating the same number of calories. Studies have shown that you can still have improved body composition even if you are eating the same number of calories. You can have decreased blood pressure and heart rate and all kinds of things doing this. But one of the benefits that ties in to lymphedema is this concept of autophagy. Autophagy is basically waste cleanup, and it literally is more like self-eating, which sounds totally weird, but it really is just your body's way of cleaning up debris. And so it's possible that this process of autophagy could help reduce the burden on the lymphatic system. And of course, the secondary benefit of having weight loss, if needed, it could be a way to do that without actually reducing without actually reducing calories necessarily, or changing your diet that much. It's another thing that, isn't right for everybody, but in some cases it can be a helpful thing to incorporate. All right, so now I'm down to this slide on a few other interesting naturopathic strategies that we might want to incorporate. And as I mentioned, of course, if you have lymphedema, you may be well aware of things like compression garments, rebounding, dry skin brushing, which I did mention on here, which, if you don't know about, is when you take a natural fiber brush, like often they have a wooden handle, and you brush in the direction of lymphatic flow, maybe after a shower or just worked into your routine once a day, and you brush from your feet up towards your abdomen, and you can also do your arms, brushing towards your heart, and just gently moving that lymphatic along. You don't need a lot of pressure for that. Your lymphatic system responds to pretty light touch, but a lot of people like dry brushing, and I like that it's something you can easily do at home. Hydrotherapy can also be helpful. That's a very classic naturopathic strategy where you can help improve blood flow and lymphatic flow by alternating warm and cool water. And what that does is cause a contraction in your blood vessels and helps kind of create a pump of moving blood and lymphatic fluid a little bit more easily. That can be incorporated in the shower or in different ways as well. There are some studies on acupuncture and lymphedema. Primarily, those are done in breast cancer or other types of cancer-related lymphedema, but it could be helpful for lower extremity lymphedema as well. Photobiomodulation is another interesting one. That I pictured here is our Theralite 360, which is a full body red light therapy photobiomodulation. It kind of looks like a tanning bed, but without the sun damage, without the problems. It's actually anti-inflammatory, and there are more and more studies coming out on photobiomodulation and lymphedema, using different techniques. Some of those use more of a handheld device. This machine, I primarily use it for its anti-inflammatory properties, and some people with lymphedema have found that to be beneficial. And then kinesiotaping. Kinesiotape is a soft, it's a flexible athletic tape that you may have seen athletes wear. And what they are using it for is to be able to be still physically active while supporting their muscles in their joints. But this kinesiotape technique you see pictured can actually help in acute cases of lymphedema or edema and help lift the skin gently and help lymphatic flow. That's not as good for a long-term management, but sometimes it can help with acute lymphedema flares. And this last slide, I just wanted to mention the InBody. This is a body composition machine that shows your muscle mass, fat mass, and water distribution that I find to be really helpful in monitoring lymphedema, because you can see the water that is drawn out of cells in lymphedema, and you can track progress with it, which is really cool. And we can look at some other factors on there too, like visceral fat, and making sure other markers of metabolic health are healthy, but especially that water distribution piece is really cool. And it's really easy to do. You just take off your shoes and you stand there for a minute and you get this beautiful printout with all your information on it. So if you are a new patient and you decide to sign up as a new patient, we are doing a free InBody test for you. You can call our office to sign up. And you can also, if you want to schedule that free 15-minute consult with us, just hang tight and we'll, on the next screen, you'll get a chance to sign up for that. But I really appreciate you guys hanging with me tonight, and I hope you learned something, and I hope to see you in the office soon. Have a good night.